heart health is tough sometimes for the average person to understand exactly what we're supposed to be looking for, and it changes as we get older. But generally, I think the misconceptions are that, well, if I feel fine, I'm okay, and I must not have any issues. And so that's not always the case. So we recommend in our offices, a yearly exam so that the patient can spend time with their doctor discussing how they're feeling. If there's a change in their condition, the doctor can pick up on that quickly and really come to a conclusion that maybe not everything is okay. So just because you're feeling well doesn't mean you don't have some underlying issue.
That's great. And that kind of leads to my my next question with regard to how can individuals assess their risk for heart disease? I mean, what are some of the things that seniors or anyone for that matter, but certainly seniors should be thinking about?
I think the most important thing for seniors to recognize is that if there's a change in how they're feeling from their baseline, then that's a signal to go get checked. If all of a sudden they're maybe more tired than usual and there's not a good explanation for that, or they're becoming more short of breath, they don't have to necessarily have chest pain. They can just be experiencing shortness of breath, change in their condition, maybe their weight's fluctuated, swelling in their feet, etc. Those are times where it's time to make an appointment, go see your doctor, and get checked out. Um, there's more specific things that they can do, like the heart scan. A lot of the hospitals have promotional coronary CT scans that are inexpensive. Some hospitals offer them for $49 screening, where you can get your lung scanned and your heart scanned to check for calcium in the arteries that can sometimes um, uh, underline there's some existing coronary artery disease that maybe you didn't know you had. And so those are some common things that people can do to assess. But I think the main point I'd like to make is if there's a change in the baseline, if there's a change in how you feel. Women in particular may not have chest pain, they may not have shortness of breath. They just may say, I'm more fatigued than normal, and that's a sign to get your heart checked.
That makes sense. That's great. And that kind of speaks also to, what are some of the early warning signs, of a heart attack or other cardiac event?
Well, a lot of people think that the typical presentation of a heart attack is someone clutching their chest and collapsing with pain. And that necessarily isn't always the case in men or women. Certainly, uh, men may experience more pain as the initial presenting symptom, whereas women may just, like I said before, have fatigue and shortness of breath and not experience pain. But if there's pain on the one side of the chest, radiating up into the jaw, sweating profusely, perspiring, sudden shortness of breath, can't get your breath, feeling like your heart is racing. Those are all signs that you could be having a heart attack or some other cardiac event like an arrhythmia or something of that nature. So those are the things to look for. But again, it can also be something more subtle. You're out cutting the grass, and all of a sudden you develop some chest pressure, and you sit down and it goes away. And then you resume cutting the grass and you get chest pressure again. So, and they say, well, I'm okay if I sit down, but that's a sign that there could be a blockage, a significant blockage in one of the arteries. And so you'd want to get checked out. A lot of times people will develop these subtle signs week or 2 or 3 weeks or 4 weeks before an actual heart attack. So the body gives you a warning sign. And so I would encourage people to not overlook those initial warning signs and get in to see the doctor, get it checked out.
Those are all great points. And I guess that also then goes to how does aging impact the heart? What should seniors do to maintain cardiovascular health? And are there unique heart health concerns for seniors they should be aware of when they think about their cardiovascular health?
I think that the initial thinking from a lot of people is that, well, if my cholesterol is okay or has been checked out okay in the past, I don't have to worry about it. But there's so much more involved with cardiac health than just cholesterol. Um, that certainly needs to be checked. A fasting, what we call a fasting lipid panel annually should be done, an annual visit to the doctor at the minimum when you get over 65, checking your blood pressure, having a home cardiac blood pressure machine is good. The standard across the United States has been for many years now that we want the blood pressure to remain under 130 over 80. There are some recent studies that changing that to 120 over 80. But the important thing for seniors to remember is that as we get older, that top number, the systolic blood pressure, can rise a little bit. And it's not unusual to see that higher than it would be in younger individuals. But you certainly want to keep the blood pressure under 130 over 80. If you see a change in that, then that's a signal to pay attention to your heart health as well as the cholesterol. There are other tests that your doctor can do to check for inflammation in the body. We're continuing to do new research, particularly at the Cleveland Clinic, which is one of the leading centers in the United States, focusing on heart health for all people, but certainly as you get older, to look at what we call inflammatory biomarkers, which are blood tests that look for inflammation in the blood that can contribute to acute coronary events that may be outside just a regular cholesterol check. So all of those things are important, as well as maintaining your blood sugar to keep that under a fasting level of, between 70 and 100, and to keep your 3-month average of blood sugar, which we call the A1C, keeping that under 5.7%, or if there's a change. I think basically keeping that data so you can compare from year to year. I think those are the main things that I see, not just to get something checked once and say, oh, I'm okay, but particularly as we get older, to have that looked at yearly or even twice a year.
That's great. And when you talk about that, I also think about caregivers, and how can caregivers or family members even help seniors manage some of these heart-related conditions or these type of maintenance activities?
It's very difficult as we get older because we have different doctors seeing us, and one doctor may prescribe one medication, another prescribe another medication, and it can become overwhelming for seniors to make sure they're taking all of their medicines correctly at the right time. So it's important, at least in the pharmaceutical area, to have a caregiver, a close family member, spouse, uh, uh, an adult child, or any other caregivers that you have at your disposal to make sure you're taking your medicines correctly. And also just to monitor for changes, as I said earlier, changes from the baseline. So if a family member or a spouse says, well, you're not moving as well as you did a couple of weeks ago, you seem more short of breath, the patient may say, no, I'm not short of breath. And then the spouse may be observing it. And so a lot of times in the office, I'm very thankful to have the spouse or family member come in with the patient, because we can learn a lot more, and the close family members or other caregivers um, can be more objective in helping the patient or the senior, keep keep abreast of what's going on. So I think that's where the caregivers can initially help, not only with medications, but maintaining appointments. Just you don't have to be a nurse or a doctor to see if there's a change in someone's condition.